the platelets, so what happens here is that for some reason, this is fat, right? So when the blood is going too fast, it's gonna, sometime a piece of this fat will get ripped off. And for some reason, your platelets, they'll see that as a wound, like if you got cut. And what do platelets do again? They scab. So they're gonna see that as an injury. And so what happens is the platelets, the dark ones, we'll say the dark here is the platelets, they're gonna start to bunch up because they just want to fix the problem. Well, when they start to bunch up inside a small coronary artery, that's a problem. That makes sense? Because now we're cutting supply of blood to a part of the heart. Okay? So, now I'm going to go into the drug. There's 2 drugs you guys can give this patient that will help him out. One of them you guys can give right now because everybody has it. It's aspirin. Okay? So aspirin does 2 things. That's the question that you guys kind of had earlier. Aspirin does 2 things. Besides take away the pain, it also affects your platelets. So this part that makes the scab, it takes away the stickiness. They're sticky. They just bunch up like patches. All right? So you want to give your patient 1 to 4 chewable tablets of baby aspirin. All right? So if you're a note taker, I write that down, especially for ACLS. All right? What they do, they take away the stickiness from the platelets. That's all it is. So now what happens is the platelets they were sticky, they were starting to bunch up, and when you gave them aspirin, you stopped them right there. So now it's not going to grow. So now Grandpa might actually survive. Grandpa might actually stay alive now until the paramedics come because you gave them aspirin. Okay? So that's what aspirin does. Aspirin takes away the stickiness from the platelets. That way they can stop right there and this doesn't grow anymore, so it doesn't completely become blocked. Okay? Cool. Let's see. So yeah, so anytime you guys hear plaque, so these pockets of fat in the coronary artery, they're called plaque. Plaque is just fat. It's just fat inside the vessels, that's all it is. Extra note. And then I'm gonna go over one more drug, and I'll leave you guys back. Leave you guys back alone to finish what you guys were doing.
Yes, sir.
Okay. All right. The other drug that you guys can only give if you're EMTs is nitroglycerine. We'll call it nitro, right? Nitro. It's a vasodilator. Layla, if I say vaso, what do you think of?
Basil?
What do you think of? Like, what comes to mind? Anybody?
It's a fancy term.
For what though?
Isn't it basil? Basil?
Basil.
Or basil?
Basil.
Basil. With a V, okay.
V-A-S-O.
I got a basil, like what you
So vasodilator. So what do you think that would be? Vaso what? Vessel. Easy. Vessel. So vaso means vessel. It could be an artery, it could be a vein. It doesn't matter. But it's a vaso means vessel. I'm trying to get you guys to comprehend this. So vaso means vessel. Whenever I say dilator or dilation, what do you guys think of?
Smaller.
Bigger. So like when think of a woman having a baby, everyone heard of, oh, it's dilating. It means it's getting bigger. It's dilating. Like anytime you've seen a movie or something, it's dilating, it's getting bigger. So vasodilator means vaso means vessel, dilator means gets wider or bigger. So nitroglycerin is something else you guys can give a patient if you're an EMT. And what it does, it makes the vessel bigger. It's a vasodilator. It makes the vessel get wider. All right. So think of this like a car accident. Let's say that for some reason this patient couldn't get the aspirin, and it became completely blocked. Now, by definition, this is a heart attack. It's completely blocked. So that's a heart attack. So the only thing that would help this patient out at the basic level is nitroglycerin. And what it does, imagine that this coronary artery, that is like the Highway 80, and this right here, the blockage is it's a car crash. So what nitroglycerin do, so nitro, I put it here, it's like they're like magic construction workers. what would you want or hope for? And there's a car crash on Highway 180 for extra lanes, right? They'd be helpful.
Right.
So what this does is that it makes the vessel bigger. It's a vasodilator. It's gonna dilate. So they're like so nitroglycerin is like magic construction workers that make the highway
Bunch of
bigger,
Mexicans.
and then the blood can go around the car accident. Okay, so that's what it does. Okay. Any questions? The 2 drugs you guys can give a patient.
But what's wrong with Viagra now?
What's up?
What's wrong with Viagra now? Right.
That's like a side thing. Yes, there's something to know, but not when you're working, you know? Like it does the same thing as nitroglycerin. It just has different side effects, but essentially it could potentially, theoretically, still save someone that's having a heart attack because of what it does. It's still a vasodilator.
And you can only stack 3 vasodilators, right?
Yeah, and after that you gotta call